Navigating the body, anatomy and terminology. We'll look at some different anatomical reference points and positions that may help you during this class. We'll start with regions of the body, the anterior surface of the body. There are different areas such as the cubital, brachial, axillary, pectoral, facial, mandibular, supraclavicular, antecubital, palmar, patellar, crural, dorsal, plantar, femoral, pubic, inguinal, and abdominal areas of the body. The regions of the body posterior. We have the cranial, cervical, cephalic, acromial, scapular, thoracic, lumbar, sacral, pelvic, carpal, dorsal, digital, gluteal, popliteal, and sural areas. Planes of movement. A plane is an imaginary flat surface that passes through the body. We break the body into three different planes. We have the transverse plane, the sagittal plane, and the frontal plane. As far as these planes and axes of rotation, human movement is described in three dimensions. There are three planes of motion that pass through the human body: the sagittal, also known as the median plane, the frontal or coronal plane, and the transverse or horizontal plane. There are also three axes of movement rotation: the sagittal axis, the frontal axis, and the vertical axis. The sagittal plane lies vertically and divides the body into right and left parts. The frontal plane also lies vertically, however, it divides the body into the anterior and the posterior parts. The transverse plane lies horizontally and divides the body into superior and inferior parts. The next part of our lecture includes the directions and the positions of the body. These include the superior-inferior, cranial-caudal, anterior-posterior, medial-lateral, proximal-distal, and superficial and deep. In anatomy, the term superior refers to a position or a structure that is closer to the head or the top of the body. This is an anatomical directional term used to describe the relative location of organs, tissues, and other structures. In anatomy, the term inferior means below or lower. This is used to describe a position of a structure in relation to another structure. For example, the feet are inferior to the head, and the liver is inferior to the lungs. In anatomy, cranial refers to structures or relating to the skull or cranium. Caudal refers to anything that is away from the head or lower. For example, the foot is part of the inferior extremity. Anterior or ventral is the front. For example, the kneecap is located on the anterior surface of the leg. Posterior, also known as dorsal, is the back. For example, the shoulder blades are located on the posterior side of the body. Medial is towards the midline of the body. For example, the middle toe is located on the medial side of the foot. Lateral is away from the midline of the body. For example, the little toe or the baby toe is located on the lateral side of the foot. Proximal and distal. Proximal refers to towards or near the trunk or the point of origin of a part. For example, the proximal end of the femur joins with the pelvic bone. Distal is away from or the farthest point of the trunk or the point of origin of a part. For example, the hand is located at the distal end of the forearm. Superficial and deep. Superficial refers to the outside layers and deep refers to the deeper layers. Ipsilateral and contralateral. Ipsilateral refers to the same side of the body. Ipsa, same side, and contra is on the opposite side of the body. Contralateral, opposite side. Next, we'll discuss movement terminology. This includes terms such as extension, flexion, adduction, also known as adduction, abduction, known as abduction, medial or internal rotation, lateral or external rotation, rotation, circumduction, lateral flexion, elevation, depression, supination and pronation, inversion and eversion, plantar flexion and dorsiflexion, protraction and retraction, deviation, opposition, prone, supine, and side-lying positions. On this slide, we see examples of extension and flexion of the hands. In extension, the fingers are moving away from the palm. In flexion, the fingers are moving towards the palm. This slide includes examples of AD and abduction, adduction, and abduction. In adduction, we're moving towards the midline. For abduction, we move away from the midline. This slide includes examples of medial or internal rotation and lateral or external rotation. This is an example of spinal rotation. This slide has an example of circumduction. Joints like the shoulder and the hip are allowed to do circumduction. Usually this is required of a ball and socket joint, such as the hip or the shoulder. Circumduction occurs when the joint moves in a circle. This is an example of lateral flexion of the cervical spine. This slide is an example of elevation of the scapula and depression of the mandible. This slide includes examples of supination and pronation of the forearm. This slide is an example of inversion and eversion of the ankle. And this slide is plantar flexion and dorsiflexion of the foot. In plantar flexion, we're pressing down like you're pressing on the gas pedal. Dorsiflexion would be bringing the toes up towards the shin. This is protraction and retraction. In protraction, the chin would be jutting out. In retraction, the chin would be sucked in. In deviation, the chin would be moving side to side. For opposition, we could touch our thumb to our pinky. And these are different lying down positions, such as supine, lying on our back, prone, lying on our stomach, and side-lying positions. Many movements are described in anatomical movement planes. Movements can occur in the sagittal plane, about a frontal axis. These movements include flexion, extension, plantar flexion, and dorsiflexion. Here are some examples of those movements: flexion extension of the wrist, flexion extension of the elbow, flexion extension or even hyperextension of the shoulder, and flexion extension and hyperextension of the hip. This could also include the lower extremity, such as flexion extension of the knee, flexion extension hyperextension of the spine, and flexion extension hyperextension of the cervical spine, and dorsiflexion and plantar flexion of the ankle. Some examples of sagittal plane movement in real life include walking, squatting movements, and overhead press. Movements can also occur in the frontal plane and occur about a sagittal axis. These include abduction, adduction, inversion, and eversion. As a reminder, here are some examples of those movements: adduction and abduction of the shoulder joint, AB and adduction of the hip joint, radial and ulnar deviation of the wrist joints, and inversion and eversion of the ankle joint. We also have lateral flexion or lateral deviation, lateral flexion of the spine, and lateral flexion of the cervical spine. Some real-life examples of frontal plane movement include a star jump, lateral arm raises, and even side bending. Movements can also occur in a horizontal plane about a vertical axis. These include rotational movements, such as external or internal rotation, circumduction, and pronation and supination. Here are some examples of those Here are some examples of those movements, such as external and internal rotation of the hip, internal and external rotation of the shoulder, horizontal abduction and adduction of the shoulder, horizontal abduction and adduction of the hip, supination and pronation of the forearm, rotation of the cervical spine, and rotation of the thoracic and lumbar spine. Some real-life movements of transverse plane motion include throwing, a baseball swing, and even a golf swing. There is a tendency when describing movements to be referred to in a particular plane in which it is dominated. Descriptions of walking are commonly described as a sagittal plane movement. However, that is not entirely accurate. These descriptions are usually just a gross directional movement. At individual joint levels, movement occurs in multiple planes of motion, and not solely in the sagittal plane. During walking, the hip also flexes and extends in the sagittal plane. At the same time, it adducts and abducts in the frontal plane, as well as internally and externally rotating in the transverse plane, although the frontal plane and transverse plane motions are much smaller than the sagittal plane motions, which is why it is primarily described as a sagittal plane motion. When we're training our individuals following injury, many individuals choose to train on machine-based exercises. While these machine-based exercises are extremely functional, they typically trap an individual in a specific plane of movement. However, this can miss other components of functional training, as it only allows for one plane of movement at a time. For example, we have quad extensions, bicep curls, hip adduction or abduction machines, hamstring curls, calf raises, or tricep presses. In the real world, movement is dominated in the sagittal plane and is followed closely by the frontal plane. In third place is the transverse plane. Even when dumbbell weights are selected over machine weights, the plane that the dumbbell exercises often are based on. The plane that the dumbbell exercises are often biased towards still remains in the The plane that the dumbbell exercises are often biased towards still remain the sagittal and frontal planes. For example, bicep curls, lateral arm raises, overhead presses, and tricep extensions. With this being said, many people are taught weightlifting and general movement training, but this should only occur in a strict plane of movement, usually the sagittal or the frontal plane, to avoid being hurt. However, the functional activities of life and sport do not occur in a singular plane of motion. For example, rolling, walking, skipping, twisting, running, jumping, hopping, catching, throwing, kicking, climbing, squatting, pushing, and pulling, as well as many other life movements, occur in multiple planes of movement. So if we're only training in one specific movement and in specific planes of motion, we could actually make our individuals not specifically functional and ready to return to activity. So we need to make sure, as we're returning from injury, that we're actually training people for multiple planar activities. So multiplanar movements dominate our activity of life and sport. Most popular training methods do not account for the frontal plane and usually neglect the transverse plane entirely. Multiplanar movement is essential components for functional training to prevent or recover from injuries, particularly depending on which area you decide to pursue for your future career options. So it's just something to think about whether you decide to become an athletic trainer, a physical therapist, a strength and conditioning coach, a coach, or even a parent yourself, or maybe you're just a weekend warrior. Multiplanar training can really prevent a lot of injuries and can make yourself much more healthy down the road. Just something to think about.